Hey, good morning. How are you? My name is Brittany. I'll be your nurse today. We have some orders from your physician today that we need to put in a Foley catheter. We have been educated that you were having some incontinence issues, and this will provide you dignity and will help prevent bedwetting while you're here at the hospital. First, I'm going to perform hand hygiene. And then I'm going to check the patient's name and date of birth. Okay, patient stated their name and date of birth. Can I check your wristband, please? Okay, so we verify that this is the correct patient for the Foley catheter. Are you allergic to any latex, tape, or iodine? Patient states that she is not, so we're good there. We have adequate lighting and the temperature is okay and the patient is comfortable. We are going to provide her a blanket. That way she can feel comfortable while we have her undressed from the waist down. And we're going to assess the vagina for any perineal care prior to the Foley catheter. And the patient looks relatively clean, so we do not have to worry about that. We are going to then place the patient's knees up in dorsal recumbent position. So we have the patient legs up. And then we are going to start opening our sterile kit for the procedure. I'm going to keep your fingers within 1 inch of the border. And anything you don't need that's in the packaging, you can just toss it. Since we're not doing a male catheter today, we're going to go ahead and drop that. And then as well with the pad that we're going to place in between the patient's legs, you want to grab it by the 1 inch border. I'm going to use the shiny side up. And then you just let it fall. And if you need to adjust it, you come around the patient. Don't ever go over the patient's legs. Still keep in mind to keep that 1 inch border. All right, this is going to provide protection of the linens while we're doing the Foley. All right, so that is set up. I'm going to go ahead and put on my sterile gloves. Gloves are tricky. Okay, and some of the ends may be rolled up at the end, but that's fine. So we have our gloves on now. So now we can start setting up. I'm going to turn this box, keep it in with the 1 inch border that we used as our sterile plane. remove the stuff that we don't need. All right. Make sure you hold that so it doesn't go flying everywhere. We're going to hook up our syringe. Go ahead and have that prepared so when we bring the box over to the patient, or the kit over to the patient, everything will be set up. I'm going to go ahead and put the lube in here. And we are ready to go. So we're going to come over here to the patient. I'm going to set the kit right in the center, away from the non-sterile border. Okay. Let's see. All right, so we're going to go ahead and prepare this. All right. So with these, we're going to cleanse the outside of the labia furthest away from us first. All right. Don't ever come backwards. You just go around, drop. Next, we're going to do the closest side to us. Clean that. Come back around. And then next, we'll do the center. And come back around and drop. And then we're going to go ahead and lubricate the tip of the Foley catheter. And then we're going to hold the labia open. And then we're going to just, reassure our patient that everything is going to plan and let them know that she may feel a little pressure as the catheter is entering. So we're going to advance the catheter until we see a flash of urine come through the tubing. All right, and we see the urine coming through the tubing. And then once that happens, then we advance the catheter another 1 to 2 inches since we are now in the bladder. Okay. And you're going to hold the tubing, that way it doesn't fall out in case the patient pushes or anything of that nature for it to fall out. Okay, we're going to go ahead and start inflating the balloon inside the bladder. You don't want to do it too fast either because the tubing can pop. All right, and then once the tubing is in, or the sterile water is in the tubing, it's created that balloon effect. You want to hold on, you want to still hold the tubing, but then remove that so the water is not coming back into the tube. All right. And we're going to slightly tug on the catheter just to make sure for proper placement. And we see that it's not coming out. All right. You feeling okay? You just want to make sure the patient's okay since the procedure's been performed. Then you would take the bag of the Foley catheter, and you can either tape it to the inside of the patient's leg make sure it's stable, or you can bring it over the patient's leg. You don't want to take it under because the patient could roll on it and cause the tubing to kink up to allow It won't allow the urine to come into the bag. It'll back up into the patient's bladder, and it can possibly cause infection. So you can either tape it, or you want to come over here and hang it on the side of the bed to allow that urine to flow freely into the bag. And then we would remove our gloves. Perform hand hygiene. And if you wanted to come back, say the patient's being discharged or the removal of the catheter has been requested by the physician, you would just come back in there, perform the same thing, and then you would hook the syringe up to it, and the water should start freely coming back into the tube, but I usually will, allow the sterile water to come back in quicker by pulling on the plunger, just because it can take some time, and some of the patients, they will get uncomfortable. So once that comes back in, it should be around 10 milliliters. And then you just release. And then the catheter the balloon should have already deflated inside the bladder, and then you just pull it out, and that's it.